In South Africa, over 200 people die from heart disease every day, making it the second biggest cause of death in the country. Having high blood pressure, diabetes, or being overweight make the chances of getting heart disease or having a stroke bigger.
Scientists are working hard to understand the medical causes of heart disease and strokes and how they can be prevented. But many scientists never get the chance to meet and talk to people who live in places where the disease they are researching are most widespread. Likewise, those people who are most at risk of getting heart disease or having a stroke don't usually get opportunities to meet heart disease researchers to find out what they do in their research labs. The Heart of the Matter project has brought together a team of scientists from Stellenbosch University and a group of residents of Delft in Cape Town to exchange their knowledge, experience and ideas about what is driving the heart disease epidemic in urban South Africa and what can be done to stop it. This film was made in partnership by 6 scientists and 19 Delft community members who took part in the Heart of the Matter project. As participants in the project, we took part in workshops to learn about filmmaking and then went into Delft and Tygerberg Hospital to make this film.
Heart disease is a very big problem in Delft. Many people suffer or die from diabetes, high blood, stroke and heart attack. Many people are overweight. Direct or indirect, everyone in our community is affected.
Our role as scientists is to identify problems in the community and then also find solutions for these problems. We need to work with the community and we need to understand where they're coming from and also what problems they are experiencing. We use animals in our labs to research these conditions and also risk factors that may contribute to developing these diseases.
Heart disease is one of the biggest killers worldwide. Lifestyle factors such as sedentary lifestyle, not exercising enough, smoking, eating unhealthy, they are the biggest contributor in developing heart disease.
We have also learned that if you don't get enough sleep, then you have a higher chance of getting heart disease. But sometimes it's hard to get a really good night's sleep in a place like Delft. Because of the lifestyle, there are lots of parties and sometimes it's hard to get sleep. The food we eat and the lifestyle we live play an important role in getting heart disease, but it's not always easy to get healthy food in Delft. The scientists that we worked with were heart disease researchers from Stellenbosch University, so that they could understand how hard it is to buy healthy food in Delft. We took them to the busiest part of Delft. We gave each of them 20 rand and asked them to buy the healthiest food they could find. Each scientist went to a different stall.
I bought something really simple, a bottle of water. The reason why I bought it was because it was the only healthy product in the stall that I went to. It cost 6 rands, which I think is relatively cheap. And the experience was a little bit chaotic with all the traffic and the loud sounds, but very enjoyable.
So today I bought an assortment of fruit from a vendor in Delft. It cost 15 rand. And I bought it because fruit is healthy for you and it contains a lot of fiber. I also added an avo, which is a source of good fat. And the experience was great because I was helped by a very friendly vendor to actually pick out the best quality fruit.
I bought an orange juice and a packet of popcorn. The orange juice was 8.50 rand, the popcorn was 1 rand. The reason I bought this, they were the healthiest things I could find.
I bought this fat cook with bologna on. I paid 7 rand for it. The only reason I bought it is because there were no other healthier options for me to buy, and the experience I had was quite eye-opening.
I bought a Bravo sausage. It was 13.50 rand. The reason I bought it is because it was the only thing available. And my experience was annoying because I didn't want the sausage. I actually wanted chicken feet, but I got the sausage.
I think the way forward would be for us as scientists and the community of Delft to keep our engagement going. Take what we have learned about the nutrition and how it impacts cardiovascular health. I think that if we could use that knowledge within our families and then also within the greater community, I think that would really help to empower us.
Some people don't want to listen to their doctor's advice about what they should be eating, like cutting down on sugar, salt and fatty foods. They also don't want to hear that they should try to get more exercise, drink less alcohol, drink more water, and that they should use the medication that their doctors gives them.
Because yazazi mosikuthi uyagula mama kade kutheni mama kutheni yo I'm getting stressed now
By working with the heart disease scientist on this project, we have learned that people in Delft can reduce their chances of getting heart disease by being more active and getting more exercise.
Kutheni ubilile?
Vele Jimini.
Uyakwenza ntoni Jimini?
Into yojima ndifuna ulungisa inhliziyo yami ihlale right.
Okay, ifuna ntoni?
Ndifuna uphila ubomi obude, ndi-enjoy life, ndigcineke ndi-right.
Wow, that's good.
For me to improve my health is going regularly for checkups.
We have also learned that there are other ways to take care of our hearts. By handing out posters and flyers in our community, we can help people understand what heart disease is, what causes it, and how it can be prevented.
For the last 9 months, we've been working together with scientists, and now we can see that the scientists are really interested in the communities around them. We have learned about how to live a better, healthy life, and with the information that we got out of here, we will do something better to educate our people in our community.
We hope that this film will help the Delft community to make better decisions for a better life.